Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the nerve supply of the face. The face has motor innervation and sensory innervation. We'll go to the motor innervation first. Okay, so motor innervation. To the muscles of facial expression, to the muscles of facial expression. Okay, that is carried out by the facial nerve. Okay, by the facial nerve. Facial nerve is the seventh cranial nerve. Okay, so this is the cranial nerve number 7. Okay, it comes out of the cranial cavity through the stylomastoid foramen. So it exits the cranial cavity through the stylomastoid foramen and it enters the parotid gland through its posterior aspect. Enters the parotid gland. Okay, and inside the parotid gland it gives 5 branches. Inside the parotid gland it gives 5 branches. Okay, we'll go through those branches. So this is the facial nerve. Facial nerve comes out of the cranial cavity through the stylomastoid foramen. It enters the this is the parotid gland. It enters the parotid gland through its posterior aspect, and inside the parotid gland it divides into 5 branches. These branches are this is the temporal branch. This is the zygomatic branch. Zygomatic branch. This is the buccal branch. This is the marginal mandibular branch. Marginal mandibular branch, and this is the cervical branch. Cervical branch. So there is communication between the branches, and area of distribution is also overlapped by the branches, so it may not be so much simplified. So we might have network of nerve inside the parotid gland. Even there is communication outside the parotid gland. Okay, we got the branches. The temporal branch usually supplies the frontalis muscle, and the upper part of the orbicularis oculi muscle. The zygomatic branch will supply the lower part of the orbicularis oculi muscle and muscles around the zygomatic bone. Buccal branch supplies the buccellator muscle and other muscles over the upper lip, the part of the orbicularis oris muscle. Marginal mandibular branch supplies the muscles of the lower lip and the muscles along the lower part of the face. The cervical branch supplies the muscle that is the platysma muscle. So we got the motor innervation of the facial nerve. Facial nerve innervates muscles of facial expression, like to show the emotion of horror or sadness or frowning or just blowing the mouth, okay, closing eyes, opening mouth, okay. So these are controlled by the motor activity of the muscles, and that muscles are innervated by the branches of facial nerve, okay. So facial nerve is coming out of the stylomastoid foramen, branched out in the parotid gland. So if we go to the applied anatomy or clinical anatomy, okay, the facial nerve may be damaged in the stylomastoid foramen, in the facial canal, and we may get Bell's palsy, okay. There will be ipsilateral or same-sided complete paralysis, and the person may also lose taste sensation from the anterior 2/3 of the tongue, or may not lose the taste sensation depending on the site of lesion. We may have facial palsy supranuclear, okay, facial palsy, okay, that is, this is Bell's palsy, this is a lower motor neuron lesion, okay, this is ipsilateral. Facial palsy due to supranuclear lesion will have paralysis of the lower half of the face contralaterally. So contralateral, lateral, lower half facial muscle paralysis, Okay, we got the facial nerve palsy. This is lower motor neuron lesion. This is upper motor neuron lesion. Okay. Facial nerve may be damaged due to many reasons. It's because it is the nerve which ramifies inside the parotid gland. Any parotid pathology or any type of surgery in the parotid gland or any malignancy in the parotid gland that may involve the branches of the facial nerve, and we may have paralysis of particular muscles which are innervated by a particular branch. Okay, so any type of parotid pathology, suppose parotid cancer or parotid surgery, okay, that may cause lower motor neuron lesion to particular nerve branches which are damaged due to that, or facial nerve may be damaged in newborn if there is any forceps delivery of the baby, that may be associated with facial nerve palsy. Not always, but it is possible, because in case of neonate or newborn, the mastoid process is not well developed and the stylomastoid foramen is more superficial. So in case of forceps delivery of the baby, there may be lower motor neuron lesion, the ipsilateral, maybe bilateral, depending on the situation. There will be facial nerve lesion. Okay, now we go to the nerve supply of the face to the muscles of mastication, like the temporalis, masseter, lateral pterygoid, medial pterygoid. Okay, These are the muscles of mastication. They are innervated by the mandibular nerve, a branch of the trigeminal nerve. Okay, so muscles of facial expression innervated by the facial nerve, muscles of mastication innervated by the mandibular nerve. Okay, we got the motor innervation of the face. Now we'll go to the sensory innervation. Sensory innervation. Sensory innervation is carried by the trigeminal nerve mostly, partly by the cervical spinal nerve through the great auricular nerve over the skin of the mandible angle. Okay, so mostly it is getting sensory innervation. The sensory innervation from the face is by means of the trigeminal nerve. Trigeminal nerve has three divisions. One is the ophthalmic, another one is the maxillary, and third one is the mandibular. Okay, so ophthalmic division of trigeminal nerve has 5 branches. One is supraorbital, supratrochlear, infratrochlear. Another one is the lacrimal. Another one is the external nasal. So this supraorbital, supratrochlear, infratrochlear, lacrimal, and this is external nasal. So 5 branches. One is the A is the supraorbital, then this is supraorbital, this is supratrochlear, okay, this is infratrochlear, okay, then we have the lacrimal nerve, okay, lacrimal, and this is the external nasal branch. So we got 5 branches of the ophthalmic division of trigeminal nerve: supraorbital, supratrochlear, infratrochlear, lacrimal, and external nasal branch. So entire forehead up to vertex, up to this, the tip of the nose and upper part of the side of the nose, upper eyelid, this part, cutaneous innervation is carried by the ophthalmic division of trigeminal nerve. Then we'll go to the maxillary division. So this is the ophthalmic division of trigeminal nerve. This part, maxillary division of trigeminal nerve. So if you get a question in the exam, which nerve carry cutaneous sensation from the tip of the nose? Answer should be ophthalmic division of trigeminal nerve. What nerve carry cutaneous sensation like pain, touch, temperature from the upper eyelid? Our answer should be ophthalmic division of trigeminal nerve, like forehead up to vertex. This part, cutaneous sensation is carried by the maxillary nerve. Maxillary nerve has 3 branches. One is infraorbital here, one. Then we have the infraorbital nerve here, and then we'll get the zygomatico-temporal, zygomatico-facial. Okay, so 1, 2, 3 branches. Okay, one is infraorbital. Okay, then zygomatico-temporal. Okay, then zygomatico-facial. So infratemporal, zygomatico-temporal, zygomatico-facial branches, three branches of the maxillary division of trigeminal nerve. This pick up sensation from the lower eyelid and this part of the face, and cutaneous sensation, that means pain, touch, temperature. Okay. Then we'll go to the mandibular division. This is number 2, maxillary division. Then we'll go to the mandibular division of trigeminal nerve. Okay. It has again three branches. One is the auriculotemporal branch. Another one is the buccal branch. Another branch is the mental branch. Okay. So auriculotemporal branch, that pick up sensation from the interior part of the auricle and also temple. Okay, auriculotemporal branch, you can add Roman 1. Okay, Roman 2 should be the buccal branch, and with the mental branch. Number 3 is the mental. I have shown one side, same thing on the other side. Okay, then the mental branch. Okay, we got that. So we got the branches by the trigeminal nerve that innervates the face. This part, mandibular division, trigeminal nerve. The mandible, except the angle of the mandible. That is important to us to know that. Angle of the mandible, skin over the angle of the mandible, skin over the angle of the mandible. Okay. The sensation is carried by the great auricular nerve. Auricular nerve, its root value is C2, C3. So this part by great auricular nerve, root value C2, C3. Okay, we got the cutaneous innervation of the face. Now we'll go to the applied anatomy or the clinical anatomy in relationship to that of the trigeminal nerve. Okay, we'll get term called trigeminal neuralgia. We'll go in details in our next video. Trigeminal neuralgia. We don't know the exact cause. There may be episodic paroxysm of excruciating pain or lancinating pain due to minor touch, especially on the maxillary division, maybe in the mandibular division, maybe both. Usually ophthalmic division of trigeminal nerve is not affected, usually the maxillary division. Second most common neuralgia happen due to mandibular division of trigeminal nerve. Okay, it may be due to some aberrant vessel. We'll discuss that in details in our next video. So that's all about the nerve supply of the face. If you like my video, please support my channel. Please subscribe me and share the information with your friends. Any question, please feel free to ask me. Have a nice day. Bye now.